Hi, welcome to mini lecture 5.4. In this lecture, we're going to cover a few of the categories of psychoactive drugs, namely depressants, antipsychotics, and opiates. There are a lot of different ways to categorize psychoactive drugs. Usually they're categorized by their predominant psychological effect, but many drugs have multiple effects, so it's hard to know how to categorize them. I've listed 7 general categories here, and we're going to cover them, a few of them in this lecture. And I want to start with depressants. So depressants are a class of chemicals that decrease activity in the central nervous system. We've already spoken about the role of GABA as a neurotransmitter that decreases activity in the brain, and not surprisingly, depressants work on the GABAergic system. Benzodiazepines, sometimes referred to as benzos, represent a large subset of the category of depressants. Benzodiazepines are named after the shape of the molecule. They have a benzene ring and a diazepine ring, so benzodiazepines. Benzos increase the activity of GABA in the central nervous system, and it has a calming effect. It helps people who have insomnia fall asleep. It relaxes muscles. You may have heard of the drugs Valium, Xanax, Ativan. These are all benzodiazepines. They are intended for short-term use, 2 weeks, 4 weeks, although they are prescribed sometimes for longer-term use. But the problem with long-term use with benzodiazepines is that tolerance builds up very, very quickly. And so they're highly addictive. Antipsychotics are a class of drugs that are used to help people suffering from psychosis. Psychosis is a break in reality when you hear or see or think or feel things that aren't there, like I might believe that the CIA is coming to get me. Psychosis is associated with disorders including schizophrenia and sometimes bipolar disorder. And antipsychotic medications help people manage their psychological disorders. They're not a cure for them, but they help them to manage the symptoms of their disorders, which is psychosis. Finally, opiates. Opiates work on the endorphin system. They have the potential to be highly addictive. Opiates reduce our experience of pain and make us feel euphoric, feel happy. Repeated use of opiates actually decreases your body's ability to use the endorphin system, which is your built-in sort of happy place system. Endorphins are associated with experiences of deep pleasure. So if you love chocolate, you get a shot of endorphins from eating chocolate, from laughing. Athletes get it from runner's high, which is when you push yourself so hard in your athletic event that you're actually to the point of feeling pain. If you keep going, endorphins are released and you experience something called runner's high. They're also associated with orgasm, laughter. It's a feel-good center. The placebo effect is associated with endorphin release. So you got to be careful with the opiates because you really don't want to lessen the capacity of your endorphin system to make you feel good. Opiates, as you know, are associated with the buildup of tolerance. With opiates, the tolerance problem is so big that after just a few weeks of using opiates, people find that they have to increase the strength of the opiate 10 times in order to get the same pain-killing effect. Opiates trigger a series of physiological and psychological changes, so they can relax people, help them to sleep, give a feeling of euphoria, but it can also reduce things like your respiration, your breathing, and your blood pressure. Heroin is a synthesized version of morphine. It's stronger than morphine, though, 2 or 3 times stronger than morphine. But thankfully, given the epidemic that we're having of heroin and other opiates, there are drugs available now that can stop the progression of opiates and actually bring someone back from what appears to be an overdose. It's just amazing. Okay, come right back and we'll talk about more psychoactive drugs.